All right, here we are, NSCA Essentials, Chapter 20, and we're in Presentation 3, and we're talking about cerebrovascular accidents and peripheral artery disease. CVAs, cerebrovascular accidents, are commonly referred to as strokes, and it's when you have blood flow to a particular area of the brain is either cut off by a blood clot or a blood bleed due to a ruptured blood vessel. Now, it can affect a number of different things: vision, communication, cognitive function, spatial awareness, etc. It just depends upon the location of the stroke or the CVA. Some of the things they point out in terms of working with individuals who are post-CVA are these. And I would urge you, maybe as we go through this presentation, if you've not done it with other ones, jot down some notes in terms of the specifics. They go with 3 to 5 days a week, 20 to 60-minute sessions, 40 to 70%, or an RPE of 11 to 14. And with many of the people that have had a stroke, they've been to the ER, they've had treatment, they've gone through physical therapy or occupational therapy, and then they get to you. So they'll be acutely aware of their situation. And so to a certain degree, it's not like you're being asked to recognize the stroke, although that's going to be part of your CPR training. But you have to understand the condition of the person who walks in. They may be cleared from physical therapy and occupational therapy, but they still may have difficulty doing things like hearing, talking, their vision might have trouble. They might have trouble with their vision. They might have trouble with kinesthetic awareness or balance and coordination. And depending upon if the stroke was right side or left side, it'll affect one side of the body or the other. Right hemisphere stroke, left side of body. Left hemisphere stroke, right side of the body. And then specifically where the stroke happened in the brain, that can have an effect on any number of different motor functions. You just realize, even though they come to you post-stroke and they've been through the curve and the process of going through rehab and prehab, or rehab and physical therapy, they still might have some issues left over from the stroke. And they go further in here in terms of RPE, etc. And I'll just let you kind of process this information here, but there's a couple different things here regarding aerobic exercise. And they talk about multiple 10-minute sessions throughout the day at intensity of 40 to 70. And then with resistance exercise, should be performed 2 days per week on non-consecutive days of 1 to 3 sets of 8 to 15 at 50 to 70%. So again, maybe jot down some of these notes here so you have like a little catalog of information regarding the different conditions we're talking about. With systemic vascular disorder, it comes from a narrowing of the arteries and this arterial stiffness, and it can impair the blood flow, and you end up having this claudication. Now, claudication is described as like it's aching or cramping in one or more of the calves, thighs, or buttocks during activity. So say like if you have a blood clot somewhere in the lower extremity, it might present itself in terms of cramping or soreness in the actual lower extremity. And they have different stages of peripheral artery disease, PAD, on table 20.2, and I'll go over this in a second here. But they talk about in terms of a range from no symptoms to absolutely debilitating leg muscle pain. And with the most extreme version, you end up with limb ulcerations and infections. And in essence, you have necrotic tissue, and people will not be able to walk any distance at all. So I urge you to maybe kind of wrap yourself around the concept that peripheral artery disease, being a strong risk factor for adverse cardiovascular events, including some of the stuff that's listed here, these individuals very much will have some type of combination of medications they're on to help them with their PAD, and they'll usually include any of the things that they mentioned here. And to a certain degree, you have to be able to work with these folks, but you have to be able to also understand that for some of them, there may be actual bona fide limitations. And I just urge you to kind of think through somebody who might have like a circulatory issue and they can't, or they don't have oxygenated blood or efficient amounts or enough oxygenated blood going to the lower extremity. They're going to, for example, if they get to 200 meters and they can walk, but they have a little bit of that discomfort or pain, that claudication, then they're going to be grade 1. The opposite end of that spectrum, if you have somebody who has a lower limb or foot ulceration with gangrene or necrosis of the tissues, that person's a 3. And you're going to have some tissue loss in there as well. And I where I work and where I work with individuals who are late stage diabetic, these folks, they have neurological dysfunction in their lower extremities, but they also have circulatory dysfunction in their lower extremities. And oftentimes, as a result, they end up with ulcerations or gangrenous skin tissue in their lower extremities, particularly in the feet. A little bit different than the peripheral artery disease, what we're talking about here, but still the same concept in terms of there's inhibited circulation to the lower extremities. Now with this, you're going to have to pause me and read through this and just kind of make sure you commit this to memory. There are a couple tricky test questions that focus on the material here in the pink. And depending upon a kind of pinkish purple, kind of maybe fuchsia, if I guess you'd say, but depending on the severity of the leg symptoms, individuals with intermittent claudication, IC, may be able to walk continuously for only a limited time, 1 to 5 minutes, before having to stop because of claudication pain. If we go down here, which is just basically this passage over here, I just cut and pasted and put here, other forms of exercise that can benefit the health of an individual with peripheral artery disease, PAD, with or without claudication symptoms include home-based walking programs, resistance training, and flexibility exercise using the same general fit principles for other forms of cardiovascular disease. So what I want to point out here is they're talking about, individuals with intermittent claudication may be able to walk for only a limited amount of time because of the pain, whereas an individual with peripheral artery disease, with or without claudication symptoms, including as a result of their walking, might be able to include home-based walking programs, resistance training, and flexibility in their programming. It's quirky in terms of a nuance. And then also some of the questions pertain to this, and this is why I want you guys to go ahead and kind of jot some notes down. You'll notice here, for somebody who has PAD, they're suggesting 2 times per week, 60-80% of 1 rep max for working out. So they're saying 6 to 8 resistance exercises targeting all major muscle groups, but focusing more on large lower limb musculature, performed twice a week on non-consecutive days is recommended. So they're saying if somebody has this intermittent claudication or they have peripheral artery disease, they are suggesting that you work on lower limb musculature twice a week on non-consecutive days. That's their recommendation with this. So the strength training is a little bit different, whereas up here they're talking a little bit more about walking and walking for distance, which you probably would classify more under cardiovascular. All right, I'm going to pause it here. I'm going to go over to the next presentation, and I'll be right back.